So it seems that cataract surgery would be an awful control group if you're studying the effects of a glaucoma procedure at the same time as cataract surgery. And what I mean by that is if you're looking at an angle procedure like a MIGS device, and your surgery is cataract plus MIGS device, and your control group is cataract surgery alone, well, we've seen that cataract surgery alone has a robust IOP lowering effect. So that might cloud how we envision the use of a glaucoma device along with cataract surgery. And we're starting to learn a lot from the various MIGS trials that have come out. And one of the first studies that was pretty robust was by Glaukos looking at the Istent device. Glaukos is definitely the innovator when it comes to MIGS implants, and these studies have been analyzed from left to right and all the way around. What we see here, simply put, is that the primary outcome of pressure under 21 millimeters of mercury without medications was robust in the Istent group. But if you look at the phaco alone group, so this is the third column on the first table, you can see that there's still a robust effect from phaco alone. And the question here is, when do you have to combine the MIGS device with phaco if phaco alone is quite robust? And you see exactly the same thing with medication reduction. So IOP reduction greater than 20% without medication, still very robust with both phaco and phaco plus. Follow-up studies to this with other devices, in this case a suprachoroidal device with the Cypass that is now being marketed by Alcon. Before Alcon took over, there were a few studies that were done for FDA approval, and this was the major one, the Compass trial, which showed very similar to the Istent that the control group, in this case the control was phaco alone, was quite robust in IOP lowering both at 12 months and 24 months. You see here at 24 months, 60% versus 77%, looking at the metric of IOP lowering greater than 20% versus baseline. Very robust study looking at a tremendous amount of patients, 131 in the control, 374 in the phaco plus Cypass. And it shows, I think, quite definitively that phaco alone does a very good job, and you do get extra effect with Cypass just like you did with the Istent. A third device in this category is the Hydras device. This is a device that fits into Schlemm's canal. It's 8 millimeters long versus the 1 millimeter long Istent. So we're getting into a place where you're targeting a few more collector channels with one treatment. And you see here that the robust number of patients that were treated showed a very similar effect to the other two studies as far as the cataract surgery patients showing a robust IOP lowering both at 12 months and at 24 months, although you see the trend starting to wane a little bit at 24 months, this is still statistically significant and quite robust from the baseline of around 26 or so, going down to around 19. This makes me feel very good about offering cataract surgery as a standalone procedure for many of my glaucoma patients. Although I do keep in mind that the device implantations here that you're seeing do give me a little bit more of IOP lowering. So a note of caution, we're talking a lot about the positives here with IOP lowering and cataract surgery alone, but the Poley and colleagues papers helped us understand another aspect to this. 55% of the patients had lower IOP, 30% had higher IOP, and 15% had no change. So in patients who had a pressure less than 55 millimeters of mercury, there was a 55% of patients had a higher IOP in these cases. In essence, what we're saying here is that while you do get robust IOP lowering in many of the patients, in some circumstances, you might get an elevation in pressure. In most cases, not very significant, but you should pay attention to it. And in some cases, the elevation in intraocular pressure in glaucoma patients after standalone cataract surgery can be significant, especially in these post-trab patients where the IOP may increase by around 2 millimeters of mercury on average. That might be enough where you have to increase medications or do something else to decrease the pressure after cataract surgery alone. Keep this in mind when you're treating patients.